Smith, I see that Frank was referred after failing a hearing screening at school.
Yeah, he just started kindergarten, and you know how they always do all those screenings and stuff,
Yeah.
and they said he failed, but I don't know. I don't really know like who tested him or how it's done, so I
Do
don't
you
know.
have any concerns about Frank's hearing?
Well, like both me and my husband really feel like he talks really loudly, like he's always talk loudly. And I feel like yeah, even like the teacher mentioned something like that, so I know it's not just us.
Okay. And then, has your child ever done a newborn hearing screening?
Yeah, I think he was tested, like at the hospital. I can't really remember, but I feel like he passed. I think he did.
And then since then, the next test that he did was the kindergarten test,
Yeah.
the entrance. Okay. How is your child in responding to speech and environmental sounds?
I don't know. It's like sometimes he's great, and other times I feel like I have to like keep calling his name for him to hear, and like even the teachers notice that too. So I don't know. It's like if he's like busy playing, it's like hard to get his attention.
Okay. Is there any family history of childhood hearing loss?
No.
No. Do you have any concerns with Frank's speech or language?
Not aside from just like him talking loudly, and other than that, it seems fine.
And then how do you feel about his overall development?
I feel like he's been fine. Like he's always like a really, really active kid, but his teacher's like wanting him to get tested for ADD. So I mean, other than that, though, it seems like he's fine.
Okay. And then how do you feel about that? Do you want him to get tested as well for ADHD?
Yeah, I feel like he might as well,
Okay.
just to see what they find. There hasn't really been like any other concerns with his like his medical history. I mean, they also did like that screening for like vision that they always do too, and it was fine. So
Okay.
I feel like he's fine for the most part.
Let's see here. Has your child had any recent ear infections?
Um, when he was younger, he had a few, but not any like recently or anything.
Okay. Do you know how many he's had in the past?
Gosh, probably like more so like in the winter, he would have them maybe like once or twice during the
Okay.
season, but
So the last episode would be during last winter.
probably a few years ago.
Okay.
Yeah.
Okay. And then were there any complications during pregnancy or birth?
No, he's born for full term with no complications.
Okay. And no medications at birth, no
No.
jaundice.
Mm-mm.
Okay. And any other diagnoses for Frank?
Nope, just the ADD
Okay.
recommendation for testing at least.
Yeah. Is there any family history of childhood disease?
Nope.
Okay. Is there anything else you would like to add?
Nope.
No? Any questions for me?
No, it sounds good.
Okay. We'll go ahead and get started with the testing.
Awesome. Thank you.
Visible deformity of the outer ear, pain or discomfort, drainage within the last 90 days, dizziness, serum accumulation or foreign body, sudden decrease in hearing or rapidly progressing decrease in hearing within the last 90 days, unilateral sudden decrease or rapidly progressing hearing loss in the last 90 days, and an airborne gap of 15 dB or more at 500, 1000, and 2000 hertz.